So hello and namaste. I want to invite all of you for our homeopathic pediatric online certificate course. It has just started. An introductory lecture has just uh, got over. We just did it. But you all can still join. It's a 60-hour online course, certificate course. You will get an access for 1 year. You can watch the recordings again and again. And there are some really remarkable speakers in our course, including Dr. Vijay Vaishnav, Dr. Mayuresh Mahajan, Dr. L.M. Khan, Dr. Praveen Jain, some really phenomenal teachers, and all talking about pediatrics and talking about different topics in pediatrics: the case taking, the behavior, the developmental delay, the allergy, the homeoprophylaxis, the autism, the ADHD, everything together. It's 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 a one of its kind of course, and I genuinely do believe that we are putting a lot of our energies in this course because this is one of its kind. We genuinely want to do something by which we can upgrade the education and also our own selves. So I hope that you all can still join. You can write to us. You have all the details. There is still a discount offer for next few days. Write to us, be a part of us. I hope you liked the lecture before, and I hope you keep liking it again. Thank you. The important topic in today's times. And I straight away start with case taking. Children's cases are actually the most simplest and the easiest one to prescribe. However, it's also important to very sharply have a clinical observation. My talk today is about what to observe in a case of a child. What are the main observations that would be needed? So when I am in the clinic and when I see a child coming inside with the parents, the case taking starts from the time the child enters the clinic. Just his posture, just his facial expression, just how his attitude with his parents. Just when he comes inside the clinic, how he looks in and around the clinic. Then you start looking at the physical observations for the child. How is the constitution of the child? What is the facial expression? The hair, the eyelashes, the scalp, the size of the head, the neck, the hands, the palms, the nails, the eyes, ears, nose, teeth, the color of the teeth, the tongue, the clinical examination of the child, the position in the sleep, the attitude, the behavior, the demeanor of the child, everything in a total. Today is my first session and I wanted to start from the basic, right from the time the child enters the clinic. This is my first session. What to observe, what to actually observe, what is not written in the books. After years of studying, evaluating, sitting in clinics of different grandmasters of homeopathy and seeing many patients together, I try to bring together for you the clinical observations of homeopaths through the centuries. What to observe. So let's start. We will start right from the hair to the footnail. We will go from step by step. Everything Typically, some children will come whose hair are very, very curly. One of the indication for that is mesarium. Some of them will have very, very thin hair, very thin. Some children, this is very important, have hair all over the body. Medorinum thuja thyroidinum. Some children have hair more on the chin and upper lip. Oleum jack SLE. Some children, their hair are totally, one over the other, matted like this. And how much ever you comb their hair can never be combed. Borax. Medorinum has the most untidy hair in homeopathy. It is called in clinical homeopathy by Dr. Fatak as tousled hair. Some children, just 8-year-old children, 9-year-old children, and their hair become, they say, how is a 9-year-old boy, the hair is going gray? The hair goes gray at the age of 50, 60, 70. Remedies like phosphoric acid, phosphorus, lycopodium, silica. Some children hair are so dry, lusterless, like sorinum, like sanicula. Some children, their hair are split. There is one hair and it's almost splitting in two parts. A very important remedy is fluoric acid, thuja.